Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey everyone, this is Dr. Burton, your host and creator of the Dr. Mama Says podcast. So, my last episode focused on the difficulty in making the diagnosis of PANDAS. And now taking this topic one step further, today I want to focus on management options. But once the diagnosis is confirmed, the PANDAS treatments that are available, they remain controversial. I'm talking very, very controversial. First, I need to stress that I'm an ENT surgeon, and I'm not directly involved in any way, shape, or form in many of the treatments that I'm going to be discussing. But by the time these patients make it to physicians in my specialty, it usually means that previous PANDAS treatments, they've failed. In fact, to prepare for this episode, I asked for input on social media from physicians all around the world. I wanted to get their impressions about the diagnosis and treatment of PANDAS because the syndrome is very complex and there's such a wide range of symptoms. Most of the physicians just voiced their frustrations with the struggle to confirm the diagnosis. So that means that the PANDAS treatments aren't started early. This leads to many frustrated parents who feel like there's a delay in care. But trust me when I say physicians want to cure or at least improve patients' symptoms. We're not holding out, but PANDAS treatment is directly impacted by the difficulty in making the diagnosis. Some frequent comments by physicians that I asked about PANDAS said it feels like they're traveling down a rabbit's hole or opening Pandora's box. The practice of medicine is indeed an art, and it's often based on experience. But it's always rooted in science. So before treatment can begin, a diagnosis with some degree of certainty has to be made. And remember that PANDAS is a clinical diagnosis. In my other episode, I listed a whole host of symptoms that can occur. And to make things worse, the symptoms may come and go or alternate completely with other symptoms. It makes it much more difficult to determine what the problem is and what's going on. And there's no specific test to prove that PANDAS is present, so many kids have to wait until their symptoms fit into a criteria before treatments can be recommended. The uncertainty in making this diagnosis often leads to repeating tests or ordering more expensive tests that drive up the costs of healthcare. And who's going to pay for these tests? Well, let me just tell you, insurance companies have criteria that have to be met before they pay for anything. For all medical services, medications, treatments, surgeries. So consequently, many of these PANDAS tests are not covered. Most physicians will not continue to repeat testing for a diagnosis that's made on clinical symptoms. But now there are self-proclaimed PANDAS specialists who recruit these difficult patients, and patients often will travel thousands of miles just to receive care. These PANDAS specialists spend incredible amounts of time sitting with families, counseling, discussing possible testing options, treatment options, and parents are very happy to have this time to share their concerns, to describe the complex group of symptoms that usually come and go, and to share their frustrations. Unfortunately, these long visits are not adequately reimbursed by insurance, so most of these new PANDAS specialists only accept cash. The initial visit may cost $1,000 or more. I put a link in the show notes to one mom who shared her journey and talked about spending more than $15,000 just to cover the cost of her PANDAS evaluations and treatments. The expense of this process is one of the reasons that PANDAS has been described as a disorder of wealthy children. But despite spending lots of money, the diagnosis and treatment issues remain the same. In addition to the extra long consultation time that parents get to spend with these new specialists, there often are a whole host of blood tests that are ordered. I included a link in my show notes with some of them, and I was blown away by the wide range of things that were being checked. Remember, we're talking about PANDAS, but some of the blood tests that are ordered include things for, yes, strep, a regular strep culture and a blood test, but then there were tests that were looking for mycoplasma, that's something that's common with pneumonia, Lyme disease, mono, and a whole host of other viral illnesses. This is when I need to point out, if we are talking about PANDAS, why are we checking for mono? I get that there may be other problems that are causing neurologic symptoms, but these would then fall into the category of PANS, P-A-N-S, the Pediatric Acute Onset Neuropsychiatric Syndrome. It's a sister of PANDAS, but it's not caused by strep. And it's fine to get this huge panel of blood work if we are no longer talking about PANDAS, because some of the treatments for PANDAS will not apply. Another thing I want to bring up about this extensive blood testing is that it's unclear what the results will lead the physician to do. I do not order a test if it's not going to change my treatment plan. Of course, I get the benefit of doing a strep test, swabbing the back of the throat. If it's positive, there you go. Treatment can begin. If the strep test is negative, again, go on to the blood work and see if there's a strep titer in the blood. But I think you have to be willing to accept the results of the test. Why do I say that? Well, it has been reported that blood testing for strep can be negative even in children with culture-proven strep infections. So if a physician is willing to do a blood test and believe the results and act accordingly, then it's reasonable to get the blood test. If the blood test says there's no strep, that's the end of the treatment and the diagnosis is not PANDAS. But if the physician is of the opinion that a negative test does not mean that strep is not present, then what is the value in running the test? It's a waste of money and it drives up healthcare. That particular physician has already said the symptoms are enough for me to treat, then they should go ahead and treat. I fully understand that some PANDAS experts still recommend proceeding with the treatments without any evidence of strep, but I submit to you they should not do the test. As an aside, I think everyone should ask their physician how the results of any test will change or influence the treatment. It might mean that you're going to stop a medicine, start a medicine, change a dose, but if it's just to see, might want to rethink doing that test. So, which patients should receive PANDAS treatments? Because I can't say it enough, I think I'll just say it one more time. Most physicians will agree that without a documented strep infection, PANDAS treatments are not recommended. Let's be clear. No physician wants to see a child suffer. The sooner physicians can diagnose and treat PANDAS, the better the chances are the symptoms will go away. But without clear scientific proof, different physicians can look at the available research and come to completely different conclusions about the best course of treatment. I believe it just depends on a physician's personal experience in order to decide if they're going to proceed with caution or action. Choosing caution is the most common option for physicians because it follows our Hippocratic oath, the oath we take when we graduate from medical school. First, do no harm. Essentially, this means that we need to be sure that our actions are not going to cause more harm than good. The physicians who choose action might be wanting to fill a void because science is not black and white. It may not be true and false, but they decide that they want to treat things that we cannot prove. It's a stance that they're willing to take, knowing that every treatment has possible downsides and side effects. Physicians usually only take those risks when scientific evidence supports it. The benefits need to outweigh the risks. And because many parents are very frustrated and anxious to try any potential treatment, a small number of physicians will still proceed with PANDAS treatments in kids without proven strep infections. Also, before any treatment has started, most physicians, including myself, will only treat children when they meet a specific criteria that we require in all of our patients. If a strep infection is found, it's treated with a standard protocol. If recurrent strep tonsillitis occurs, a well-established treatment option exists and it's recommended. Now, these treatments may also be very effective PANDAS treatments, but they are not recommended if the PANDAS neurologic symptoms exist without proof that strep is present. Why? Because physicians do not regularly recommend treatments that have risks when the diagnosis is doubtful or when the treatment is known to not be useful. Like when patients with a viral illness want an antibiotic. Antibiotics do not treat viral infections. Period. Hard stop. Physicians understand that patients feel better if we, quote, do something, but that is just not how we approach medical care. Okay, so now on to the meat of this episode, PANDAS treatments. There are several main categories for PANDAS treatments, and as with most things, escalating treatments also have escalating risks. The treatments I'm going to discuss involve treating the physical as well as the neuropsychiatric symptoms. So to start with, physicians focus on making sure the strep infection is completely gone, but parents will also need to be working with a licensed mental health professional who is familiar with treating OCD and PANDAS. Also, preventing strep is always better than treating it. Parents can teach kids not to share eating utensils or drinking glasses. They should also avoid touching their eyes and faces whenever possible. Basically, parents should teach kids good hygiene. Washing hands is an extremely important public health strategy. So right now, I'm going to be that proud mom, and I'm going to share my daughter's article about the power and privilege of hand washing. It was a post she wrote to celebrate Global Hand Washing Day, and I put a link to it on my show notes. So go on over there and check it out and show my daughter some love. Hey, Jazz! All right, now the cornerstone of PANDAS treatment is antibiotics. Duh. Strep is a bacterial infection, so it makes sense the treatment begins with antibiotics. Strep is a really common childhood infection that responds well to antibiotics. When PANDAS symptoms are present, parents may note a significant improvement in the neurologic symptoms within 1 week of antibiotics. Most strep infections are successfully treated with a single course of antibiotics, but a second course might be needed if ongoing symptoms are present. Just like infections anywhere else in the body, sometimes it takes more than one course. However, long-term antibiotics for any problem are associated with significant risks and complications. So the main problem with using antibiotics for PANDAS patients is that it is not just a regular infection, and it often does not respond in the way that typical infections do. So instead of using 1 or 2 normal length courses of antibiotics, some of the PANDAS specialists have been known to prescribe antibiotics for months or even for years. There is no evidence to support this treatment protocol. It has not been proven to be effective, but there is plenty of evidence to show the harm that long-term antibiotics can cause. Parents need to remember that the problem may have started with a strep infection, but ongoing PANDAS treatments need to address the other symptoms, and antibiotics don't do that. Anti-inflammatory medicines are also sometimes used. The PANDAS symptoms happen because of an abnormal response to a strep infection. When treating the infection, some physicians also choose to treat the inflammation that can also be present. In essence, physicians are trying to calm down that immune system with steroids or non-steroidal anti-inflammatory medicines like Motrin. But you guessed it, there is no proof that these medications have any significant impact on the long-term treatment of PANDAS. Treating the behavioral or neuropsychiatric symptoms is an extremely important part of PANDAS treatment. They may initially improve when antibiotics are started, but they usually still need to be treated separately. Mental health professionals often treat these symptoms with cognitive behavioral therapy. You know what? I'm a surgeon, so I'm just going to leave that fancy therapy name out there and suggest that if you're interested in more information, you head on over to the show notes and click on the link that I provided. Medications are also used to treat OCD and include a special type of antidepressant and sometimes the controversial use of steroids like prednisone. But in using the steroids to treat the OCD, it can make the tics even worse. And if the steroids do work, they can only be used for short periods of time because of the ugly long-term steroid complications and side effects. So currently, steroids are not routinely recommended for the treatment of PANDAS. Now, some kids have severe PANDAS symptoms, and they show no response to medications or behavioral therapies. These kids may have a hard time functioning in society. They may even become a danger to themselves. These are the patients where physicians begin to consider some of the more extreme treatment options to reset their immune systems. And one of these therapies is immunoglobulin therapy, or IVIG. This treatment involves patients receiving treatments through their veins with blood plasma that has been collected from over 1,000 different donors. What is blood plasma, you ask? Well, it's just the liquid part in our blood that surrounds our red and white blood cells. This type of therapy, the IVIG, is usually reserved for patients with a specific disease where monthly infusions are needed and have been shown to improve the disease. This is not the case with PANDAS. Thus, this treatment has not been designated as an approved treatment option for this syndrome. But anyway, the goal of therapy would be to kind of boost the immune system by flooding the body with healthy antibodies and diluting the harmful antibodies that are causing some of the symptoms. As you can imagine, collecting blood from 1,000 people to create a course of therapy is extremely expensive. And of course, there are many risks associated with receiving blood products. So if it can be avoided, it really should be. Now, on to something called plasmapheresis. This is another one of the extreme measures used to treat patients with severe PANDAS. When none of the other mentioned treatments are successful, this is a technique that allows patients to have their own plasma removed and replaced in a process that seems to be similar to kidney dialysis. By removing this liquid, the goal is to remove the harmful antibodies that continue to cause the symptoms. While some physicians have reported success with these treatments, there are no studies that confirm that it works, but there is significant harm that can result from this treatment. And last but not least, let's talk about the tonsillectomy. Aha! Finally, the treatment that explains why an ENT surgeon is talking about PANDAS. Although many people do not frequently discuss this option, tonsillectomy falls into that category of extreme PANDAS treatments. Trust me when I say that I only see the patients who are at their wits' end and ready to try anything to help their kids. But all surgeons need clear indications to perform any surgery, and it can't be based on a hope and a prayer. There are significant risks to surgery: anesthesia, the medications, the recovery. It can't be recommended without a clear benefit. Tonsil disease is well known. It's also known that strep bacteria can hide in the tonsils and resist treatment. There are clearly published indications for the effective use of tonsillectomy. If there is an indication for a tonsillectomy, with or without PANDAS symptoms, the surgery may be recommended. For completeness, I want to share a few tidbits of information that explains how this surgery got added to the list of potential treatments. A few small studies have shown that kids who did not respond to antibiotics might benefit from a tonsillectomy, but the studies are very small. Small studies are not the ones that give us scientific proof or that guide our recommendations. So although tonsillectomy is commonly used as a treatment option for recurrent strep tonsillitis, it is not an accepted treatment for PANDAS. And to elaborate on potential future research, there is apparently some unpublished data from Georgetown Medical Center, which is reported on the PANDAS Physician Network website. Because the study's not published, I'm going to share what's described, and it might help you to understand where some of the ideas come from. Well, apparently, surgeons at Georgetown described removing tonsils in kids that had PANDAS and checked the bacteria found in them, comparing them to the tonsils removed in kids who did not have PANDAS. Something that was very interesting was that strep was found in the tonsils of kids without PANDAS, but not in the kids that did have PANDAS. The kids with PANDAS had tonsils that grew things like Staph aureus, MRSA, and other bacteria like E. coli, Pseudomonas, and Serratia. I'm sorry, those are just some big old names that really mean nothing to you other than kids with PANDAS had tonsils that were filled with a variety of bacteria, but they weren't filled with strep. So what does this mean? It's unclear, but it could simply be a confirmation that there's a wide range of bacteria that can cause similar neurologic symptoms, and the bacteria found would each respond differently to antibiotics, and this highlights another reason why long-term antibiotics are not useful. Now, as I reach the end of this episode, I want to highlight a little bit about the prognosis of PANDAS treatments. Often, the symptoms slowly get better over several months once the strep infection clears, but there may be ups and downs, and PANDAS is very likely to come back if your child gets strep again, meaning kids are highly susceptible to recurrent episodes if they've become sensitized. Sometimes all it takes is exposure to the germs. So remember the tips that I shared about prevention with good hygiene, hand washing, changing toothbrushes often, and avoiding sick people. Some people recommend having other family members tested for strep because it's possible to have a strep carrier in the family who has no symptoms. Having a child with PANDAS can be extremely stressful because it can come on without warning. And if you have a child or family member with this problem, you might want to check on the resources that I've added links to in the show notes. Whew, okay then. Looks like I've shared all the information that I have, and this seems like a great place to stop. So for now, I've got to go. If you enjoyed what you heard, please feel free to share my information with a friend, family member, or coworker. I love to share information and look forward to chatting again soon. Thanks for tuning in. Until the next time.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to Apple Podcasts or wherever you go to listen to your podcast and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in any episode, a summary of the show can always be found online at drmamasays.com. Also, don't forget to subscribe if you've not done so already. Hope you come back and listen again soon.